Retinol, an ingredient that so many people have heard of, but what does it do and why do we need it? Retinol is a form of vitamin A. So vitamin A is what we find in carrots and it's in sweet potato in high amounts. But the vitamin A in carrots is what people used to say was what was helping fighter pilots in World War II see more easily. So vitamin A is a really important micronutrient for all over systemic health. And retinol is a form of that. When we apply retinol onto the skin, it's converted by our cells into retinol and from there into something called retinoic acid, which our cells can use. We can even get retinol or retinoic acid to apply onto the skin. So there are many different forms, and that's one thing that's important to remember because a retinol, a retinol, and a retinoic acid are not directly comparable, although they're all retinoids. So the retinoid family is powerfully anti-aging, and it's the only ingredient that the FDA allows to claim that it is anti-aging because of the wealth of data on it. It stimulates our fibroblasts to produce more collagen, elastin, and hyaluronic acid, making skin firmer and more youthful. It also accelerates the cell turnover, so it helps to clear the skin out more quickly, keeping the surface looking fresh and vital. It's also excellent for helping to control sebum production in the skin, so a great choice for people with acne, for example. For most people with acne, it's an excellent choice. A lot of people worry about using retinol because it has a reputation for causing irritation, that it might make your skin red or dry or flaky or peely, and that sometimes can happen. When we're using retinoic acid products, they're prescription only, and that can be far more of an issue because they are more potent. You're applying something much more potent to the skin. For some people, that can happen even with a retinol. So my advice is always to introduce it slowly to your routine. So for the first 2 weeks, maybe use it just twice in the week. For the second 2 weeks, use it every other day. And then if your skin's tolerated it, go up to every night. It's important to remember that you should not be using retinoids if you're pregnant or breastfeeding. And that's something that's really important to remember. There are very few absolute no's with skincare, but that is one of them. If you're introducing it, what are the other pitfalls you should be aware of? Well, it can make you more photosensitive. So that means that you become a bit more sun sensitive and could burn more easily. That doesn't mean you need to stop using it over the summer months, but it does mean that you need to be religious with wearing good sun protection day in, day out through the summer, through the winter. Another good tip is that if you're finding you're getting a little bit dry with it, when you get in the evening, do your skincare routine, put your retinol on, and then give yourself at least 20 minutes and then apply moisturiser before you go to bed. And that way you're giving something extra to help support your skin and minimise the risk of any irritation. It really is one of my favourite ingredients to use, and I believe there is a retinol out there for absolutely everybody, pretty much, even if you are more sensitive. It might mean we go more weekly to begin with, or we might use it more infrequently, but we can get those benefits into almost every skin type's routine. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.